How do you know whether you have anxiety or depression? This is a great question, and you would think that it would be really easy to answer, but it's not so easy to answer. Okay, so one thing that you should know is the term comorbidity. Comorbidity is when two disorders co-occur at the same time in the same person. And one of the most reliable rules in clinical psychology is that anxiety disorders and depression are very, very commonly comorbid. There are certainly some people who have an anxiety disorder without depression and vice versa, but more often than not, you're going to see these two disorders co-occur in the same person. So the question then becomes, well, how are anxiety and depression similar and how are they different? There's this fantastic theory called the tripartite theory, and it was developed by Leanna Clark and David Watson. And the tripartite theory lists three things that you have to take into consideration when thinking about anxiety and depression. And those three things are general distress, physiological arousal, and anhedonia. So let's go through those. General distress is just lots of negative emotion. It is what we call neuroticism. Neuroticism, remember, is just the tendency to experience lots of negative emotion. So general distress is common to both anxiety and depression. People who are anxious have lots of negative emotion, and people who are distressed have lots of negative emotion. So this is common to the two types of disorders. Second thing is physiological arousal. That's when you feel your heart racing, maybe you break out in a sweat, maybe you get a little shaky. Signs in your body that there is some degree of arousal. This, according to the tripartite theory, is unique to anxiety. And that bears out because when you encounter people who are very deeply depressed, you do not see a lot of physiological arousal in them. What you see is a slowing down, right? It's like they're moving through molasses. They feel almost weighed down. They're moving more slowly. They're talking more slowly. That's sort of the typical presentation of depression. But in anxiety, you see lots of physiological arousal, a racing heart, and so on. The third thing is anhedonia. Anhedonia is just a fancy way of saying no positive emotion. And this is, according to the theory, unique to depression. In fact, anhedonia is probably the defining criterion of depression. When people are depressed, they have a really hard time accessing joy, accessing excitement. Maybe they have a party coming up this weekend and they just aren't feeling up to it. They're just not able to get themselves excited for that party. And the things that used to bring them joy are no longer bringing them joy. And so that is something that is unique to depression that we do not necessarily see in anxiety. There is one little exception. There's some research showing that in social anxiety disorder, you do see a reduction in positive emotion. So you do see some anhedonia. But by and large, anxiety and depression, what they have in common is general distress, negative emotion. What is unique about anxiety is physiological arousal, and what is unique about depression is anhedonia, or the lack of positive affect. So try to assess for yourself whether you think you have more physiological arousal or more anhedonia, sort of that sapping of positive affect. And that might give you some indication about whether you are somebody who struggles more with anxiety, more with depression, or maybe with both.